Ladies and gentlemen, it is my honor to introduce a distinguished leader and innovator in the field of health information and digital health transformation, Dr. Alicia Harris Watts. Dr. Watts holds a PhD in health administration and education, an MBA, and multiple professional credentials, including CPHIMS and RHIA. She currently serves as the program director and assistant professor of health information management at William Carey University, where she oversees academic excellence, drives curriculum innovation, and prepares future healthcare leaders through rigorous training in informatics, data analytics, and compliance and emerging technologies. With a proven track record, with proven track records spanning clinical systems, higher education, and research, Dr. Watts has made significant contributions to the field, from optimizing EPIC systems and supporting clinical research operations to strengthening workforce readiness and achieving accreditation excellence in higher education. She has led program growth, strengthened industry partnerships, and consistently championed student success, academic integrity, and the advancement of digital health practice. Today, Dr. Watts joins us to share her insights on health informatics, data driven care transformation, workforce development, and the future of digital health leadership. Please join me in welcoming Dr. Harris Watts. Dr. Watts, do you have anything more you would like to add that I have not added that you would like to introduce yourself to the audience? Thank you.
First, I want to say thank you for that warm introduction. That was a really good bio, and can I have it? But no, I think you summed it all up. That was really good. Thank you.
Okay. Well, we'll start with the first question. What initially drew you to the field of health informatics, and how has your journey evolved?
Yes, that's a great question. So honestly, I think I got into health informatics like most people on accident. That I did not know about health informatics when I first started my educational journey. Health information management really fell into my lap, and health information management grew into health informatics. When I started my career journey after graduation, I started out as a record index specialist department. So all I did was scan and index paper records all day. But just with I guess my technical savviness, I love to learn new things. I love to learn the systems. I spoke with my manager and asked if there were any opportunities that I could, work more with the system. And they opened up for me a position. Well, it wasn't a position. It was really I was helping out with the Epic department on their help desk, the My Chart help desk, helping patients get their passwords reset or troubleshooting why they couldn't log into their accounts or just talking them through the process of how to get logged in, especially our older population. And that me helping with the help desk actually opened a door for me into Epic, where I became a certified clinical analyst. And that really just started my health informatics journey, just learning more about the systems and the importance of how the electronic health record can promote better patient outcomes and how I could make a difference to healthcare on, behind the scenes, how my work with building different tools into the system or even just training the new nurses and doctors on how to use the system or building tools for them to make them more efficient, that just opened my eyes to just this new world that I had never even realized was out there.
Right.
And just learning about that, I just wanted to tell more people about it. So they got me into education where I could share with students my journey and just let them know about this gym before they had to stumble upon it like I did.
Well, that's a powerful journey. Building on that, how do you see data analytics transforming the future of patient care and population health?
Yes. Data analytics, that's gonna be a major key in driving just better patient outcomes. That makes me think of just one of the assignments that I had one of my students do a couple weeks ago, where I had them to choose an emerging technology and they had to discuss the ins and outs of the technology. And one of the particular technologies that came up more than others, I'll discuss it more in just a second, but it was very data driven. But just based on all of the data that a healthcare organization can collect on a patient, how that data can be used to improve patient outcomes, and not only just improve patient outcomes, but also help patients be more proactive in their health. I think that's gonna make a huge difference in itself. Just patients first being able to understand the data that's being collected on them, um, understanding their health conditions, their health literacy part of it, and pulling that in with the data analytics. I think that's really gonna be a game changer. Even me personally, when I go to the doctor myself and I look at my lab work, that helps me to figure out a game plan for myself. So just it's gonna be major, in my opinion.
I concur as much. That's an exciting vision too. And speaking of implementation, in your view, what are the biggest challenges healthcare organizations face in adopting advanced informatics systems?
Well, the first thing that always comes to my mind is the privacy and security. And I know you're in cybersecurity, so you know about that more than probably a lot of us on here today. Just hearing about all the healthcare organizations that are having their patient information being taken ransom, and how that can halt healthcare services in the water. That's very scary. So definitely cybersecurity. I know most healthcare organizations now are beefing up their cybersecurity practices. They're making sure that even the non-IT professionals know, the risk that are out there, training them, making sure that, they're not clicking on those phishing emails and all of that. Definitely cybersecurity in general, privacy, just protecting patient information. Um, that's a big one, and probably governance with AI making this huge debut. Um, we have to have policies and procedures in place to make sure that things are being used ethically and in the manner that it's supposed to be used. So I think those are my top two, just governance and privacy security.
Yeah, privacy security, expanding on that, it's a major issue because a lot of hospitals in the past have gone through security breaches and things that pertain to health records. And it's more a concern when it comes to cybersecurity issues that affect hospitals or the medical field, because we're talking about people's lives are in danger. It's not as if just a ransom that they tend to ask for, but sometimes some services might not be able to work going forward. But great point. A related topic many are discussing is interoperability. How can data interoperability improve both patient outcomes and healthcare efficiency?
Yes, absolutely. So, of course, as you know, interoperability is the ability to be able to exchange that health information. And I know right now in healthcare, there's strides with fire, making sure that though that's in place to make that exchange a little more easier and more seamless. So that makes a huge difference, especially with that continuity of care. So when our patients are going to different healthcare facilities, we want that patient information to be able to follow that patient. We don't want doctors to have to guess what a patient's allergies are. If the patient comes in with an emergency, we don't want them to guess what those allergies are, what those medications are. That information needs to be able to be exchanged easily, because that in itself protects patients. If someone has a accident and they're on vacation and they need to go to um they need to have an emergency visit to the healthcare organization, if they have their license and they're say on Epic or something, if they've been to another facility that's on Epic, that information can be pulled, and it's very important to that continuity of care. Or even just a referral visit, when you are referred out and that information is your information is sent, you don't have to worry about, as a patient, oh, I don't remember what medications I'm taking. That information is automatically being sent, exchanged to the other healthcare organization, and that makes that those patient outcomes better because there's no guesswork.
Yes. I totally agree with that. And you mentioned FIRE. For the audience, FIRE is FHIR. That's how it's spelled, but it's just an extension of what you call HL7, which deals with interoperability. They're the ones who created the FHIR, which now has to do with um, bringing together different platforms and connecting them, allowing them to transfer information or personal healthcare information to different platforms. So that's a good point you made there, Dr. Watts. Um, and as innovations continue to engage to emerge, what are some of the most promising innovations you've seen in in health information management lately?
Oh, there's so many. Some of the most promising, one of the most promising that I think is probably CGM, continuous glucose monitoring. That's a big one. And that was when I was talking about my students' projects. We had a lot of students that did their project on continuous glucose monitoring, but just in my opinion, remote patient monitoring in general. That's that's I feel like that's gonna be the future. Just allowing patients to be able to take their care into their own hands. I'm sorry, my internet is a little unstable. Can you hear me?
I can hear you now.
Okay, perfect. But yes, just patients being able to take their care into their own hands. So, for instance, with the continuous glucose monitoring, if a patient notices they have spikes in their blood sugars around a certain time, that patient can be more proactive when they notice those spikes and say, hey, maybe what am I doing at this point in time that's making my blood sugar spike? So again, it's patients taking their care into their own hands and trying to figure how they can better help themselves before there's an emergency. Me personally, I have quite a few family members who have diabetes, and we live in rural Mississippi, and a lot of those family members don't have access to health insurance. So someone like a family member of mine, if they had access to a program that purchased those CGMs for them, that would be a game changer, just because um, they could keep an eye on that blood sugar before it's at a 900, and they have to be admitted into the ICU to bring that down, because that goes back into, okay, if this patient is admitted into the ICU and they don't have health insurance, how is that ICU visit going to get paid for? So CGM, it not only improves patient outcomes, but it also helps with it just helps keep healthcare costs down in general. So it's a win-win on multiple sides. So I think that remote patient monitoring is gonna be major, because it'll keep patients out of the emergency room, and it'll keep patients out of the ICU, and keep readmissions lower as well.
Right. Yeah, that sounds more something that would be related to telehealth as well. Yeah. That's those advancements are inspiring. Now shifting to AI, artificial intelligence is rapidly entering the healthcare landscape. How do you see AI reshaping data-driven decision making in health systems?
Yes. Well, AI has been actually doing that in the background for a long time now, just not on the generative AI level, but more on the machine learning level. It's been running in the background of a lot of these EHRs for a little bit, just collecting data. And it it is going to be a game changer. However, that old adage is just always true: garbage in, garbage out. If if the data that's being entered is not quality, then the output isn't going to be quality. what the data that we're looking at is not going to be quality. And that's where, with AI coming into play, we have to make sure that our providers, that our nurses, anyone who is putting health information anyone who is putting health information or health data into the systems, that they are putting accurate data in there, that they're putting high quality data in there. So when the AI does read it and report on it, it's quality. It's not it's useful. It's something that we can actually use. I wanted to say something else, but I lost my train of thought. Can you ask the question one more time so I
Well,
can
yeah,
remember what I wanted to say?
artificial intelligence is rapidly entering the healthcare landscape. How do you see AI reshaping data-driven decision making in health systems?
Yes, yes, yes. So definitely in that sense, but also if we do have the good quality data coming in, it's gonna help speed the process up on a lot of things, especially as it comes to clinical research. That was one aspect of my background. Just the data that's collected, if AI could get in and read that data and find those patterns that us as humans can't always pick up on, some of those I realize, but AI has the ability to catch. That's gonna be very helpful in the future.
Right. That's I agree to that. And it's already taking effect in so many different areas in the medical field and on so many fronts. That's fascinating, of course. Innovation comes with responsibility. What ethical considerations should health informatics professionals keep in mind when integrating AI into clinical workflows?
Is that AI is a tool and it is not there to do our job for us. We still have to have that human reasoning at the end of the day. We can't let AI just do 100% of the work because AI is not going to be 100% accurate all the time. We have to, um, it's to help us to do our job a little bit better, maybe a little bit more efficiently, but it's not there to do it for us. And that's something even as a educator that I tell my students a lot of the times. They think, well, I can do this assignment easier with AI and just shoot out an essay. Well, you can do that, but there's gonna be things in the essay that's not accurate. You have to, even if that was what you decided to do, you still have to be proactive. You have to read through that. You have to make sure that everything in there is accurate, that there's no hallucinations. You have to make sure that those sources that it's using are actually real sources and that it's not just making something up. And even back to healthcare with ambient listening AI that physicians can use um to document their note for them based on the conversation that they're having with their patient. There still needs to be someone to read through that note. Someone has to make sure that what AI has documented for them is accurate. That could be problematic, especially in healthcare, because there's always been issues with copying and pasting in healthcare and physicians not always reading back over what they copied and pasted. There's going to be an issue with AI as well. So we just have to make sure that our providers are, actually reading through what they are documenting, or even, you know, that's my main thing. That's always been my main thing, making sure that it's used as a tool and not to replace. And it
Yes.
can be in any area that AI is being used in healthcare.
Yeah, I agree to that. They are, if you don't mind my expanding a little bit more on that, it's just there are two
Yes.
aspects of the AI that a lot of folks are concerned about. It's the bias aspect of it and the hallucinating aspect of it. The bias is when information that might not be as accurate as they should otherwise be and enter the algorithms in machine learning and any other aspects of AI, and then they trigger things and information that should not have been so otherwise. And the hallucinating part of it is that you would not get a response from AI that would tell you, you know what, I don't know this, therefore I'll look it up for you later or anything like that. It will just produce or generate something for you. And here you are thinking such a machine is so intelligent or more intelligent than you are just going to trust that information. Unbeknownst to you, you would not even know this information might not be correct. And that's where these things are combined because those algorithms are based on past information being retrieved in a big data set, and they could be from the internet, they could be from anywhere. And you have to be careful either as a student, either as anybody using those tools, like you mentioned, where they need to make sure this is not something they're just gonna take at face value and not reviewing them. Um, Excellent insight, though. Let's talk about preparing the next generation. At William Carey University, you prepare future leaders in health information management. What competencies do you believe are essential for students entering the field today?
That's a great question. In the health information and health informatics realm, there are changes on the horizon. especially from our accreditors that most of us use, we are transitioning to what's known as competency-based education. And with that type of education, it's based more so on authentic learning and not so much just theory, answering questions in a book. The main thing that is supposed to be pushed out now is for our students to actually be able to do things when they get into the field. So we want it to feel real for them. So for instance, when we are in our informatics class, we use a simulated electronic health record so that students can start understanding, okay, this is how this electronic health record works. This is what our registration team does. This is what the billing team does. This is what the physicians do in the system. And then based on that, they can learn how to develop different workflows um, that might be helpful or to help whomever be more efficient in their job. So that's one thing, just helping students to actually do things that feel real so that when they get into the field, they actually know how to apply what they are learning. Another major competency for sure is data analytics. In our program, we do hone in on that data analytics and the informatics. So now in our program, with that real with that real authentic learning, we are implementing um, Power BI and Tableau, giving our students data sets that they have to actually filter through, that they have to sort through, that they have to clean up and come up with insights based on this data. They have to run different statistical tests to paint a picture. So to help a healthcare organization, even though it's not a real healthcare organization, it's still a fictional one, but everything feels real to the students. And it's something they might actually do in the field. So they paint a picture of how, based on the data, of how this healthcare organization can improve their operations or improve different aspects of whatever they might be doing, and showing how they can learning how to they can visualize that data and show that data to different audiences so that it's easy to digest. That's one competency, and just that are out there. Um, they're learning about blockchain, they're learning about quantum computing. These things might not be here just yet, but they might be in the future, and they can set them apart when these things are, implemented. Because at least I know a little bit about this. I learned about this. Let me learn a little bit more so that I can kind of dip my toe into that whenever it makes its debut.
Foundations to be able to pick up on that. Yeah, those skills are very crucial. With technology evolving rapidly, how do you balance teaching foundational HIM principles while also preparing students for emerging technologies like AI, blockchain, and predictive analytics?
Yes, and it's very hard. um, like I said, we are implementing these new competencies to try to close that gap between um, education and practice. Because one thing, and you've been a student for long enough, and you've been an educator as well, you know that the textbooks that we get cannot keep up with the technology. We'll have a textbook that came out this year, and a new technology comes out next year, and that book doesn't re-release until the next 5 years, which is problematic.
Right.
Creative, we have to start pulling in. Well, what I do I pull in articles, whatever I see. That's when I get my newsletters from my professional organization, and I see some nice articles in there about something that's happening now. I'll add that into my class. I have a little module with just health informatics headlines, what's happening now. So that way students can always, if they see something, they can go to that module and say, oh, it looks interesting. Let me see what's going on with that right now. So that they can start now trying to wrap their mind around, hey, this is going to change soon. Start learning about this now. So that's one way that we're trying to do that. Just the updated articles and just trying to tie that back to what they're learning in the books, because and that's another issue I'm kind of running into right now with even certification exams. The certification exams, they're going to be tested on what's in the book. Well, if a policy changed recently or some new technology came out, they'll know what's in this book, or they might get mixed up with what's happening now and what's in the book. So when they get on a certification exam, that might cause confusion for students. So that's something I'm trying to work through right now as well.
That balance is key. Beyond coursework, what strategies do you use to connect academic theory with real-world informatics practice?
Yeah, and I think I talked about it a lot just with the articles, and like I said, with that simulated electronic health record. So for instance, right now in our data analytics class, we're using an electronic health record, and there's assignments in there where students can query readmissions, and they can query length of stays, and they have an assignment that they do. So they query, then they run the data, and they find insights on our length of stays at this hospital. So it's data from this electronic health record. So they're connecting real world experience with the theory. So they learn about it, and then they practice it in this simulated electronic health record. And they do data visualizations based on the data that they pull from this simulated electronic health record. So that's how we're doing it right now. So thankfully, we have these organizations that have these simulated health records that we can use so that our students can start applying that theory with that practical aspect of things.
Interesting, great perspective. Now let's discuss leadership. You've held multiple credentials across informatics, analytics, and administration. How has this multidisciplinary background shaped your approach to leadership?
Yes, that's a great question. For me, I think having that diverse background helps me to appreciate same background as me. I can appreciate. So, for instance, I have this healthcare background, but I also have a business degree. So, if I speak to someone with a business degree, I can relate to them just like I can relate to someone that has this health information management background. I think that's a major key with just being able to connect with people and collaborate. I think that makes a huge difference in leadership. If you can't connect with people of from different disciplines and different backgrounds, and if you can't network and build, then it's going to be very hard for you to be a leader, because being a leader is more so dealing with people than anything else. just dealing with people and personalities. So, like I said, that my background being diverse helps me to relate to people just in different aspects, I believe. Even with you, I don't have just the cybersecurity background, but I know a little bit about privacy and security, HIPAA and all that on the healthcare side of things. So that's kind of how I can relate to, someone who has that aspect as well. So I think it's pretty cool having different backgrounds like that.
Yeah, absolutely. It allows people to communicate better in terms of knowing, learning from each other. So that's always a beautiful thing. And learning is a beautiful thing in such a way that you can learn from each other all the time. So
Absolutely.
yeah. Um, for those, I think I had this question here. What advice would you give to young professionals as aspiring to become leaders in health informatics or HIM?
Always be willing to learn.
Yeah,
Always be willing to learn something new because, as we said, the technology is advancing rapidly.
right.
And if you want to have a career in this field, you have to be able to keep up with the changes. You have to be willing to learn about these things. You have to stay ahead of the curve. And that just comes with just being willing to learn. And also being adaptable is huge because with these advancements, change
Yes.
change is gonna happen,
Yeah, it
and
doesn't wait.
it does not wait. It waits on no one. So you have to be open to just adapting to those changes.
Right, that's for sure. And lastly, on leadership, can you share a defining moment in your career that reinforced your passion for advancing digital health innovation?
Ooh, that's a great question. I think my defining moment was probably it was when I was a clinical analyst and I was talking to one of my team members and I was working on a project. It was a really difficult one and it had me questioning things. But we had a discussion and that discussion was about purpose. And I had just read or heard from someone. I can't remember who it was. It was someone with the podcast at that time, about how your purpose makes room for you. And at that time, I was younger. I was still figuring it out. And I had this conversation with one of my teammates, one of my colleagues, about purpose and if he felt like he was in his purpose at the moment. And he had a similar background as you. He came from the computer technology world. He taught math for a while and he got into healthcare doing reporting. So he loved working with the numbers and working with the data. That was his thing. And I was asking him if he thought he was in his purpose, and I was trying to figure out my path at the time. And I remember having a conversation with him and I said the the thing that I feel like I do better than any other thing that comes easy for me is learning. Um I just being in school, I've always just loved to learn. I've always just loved education. And I asked them, I said, how can that be my purpose? That I can't make money off of that. I can only go in debt from learning, from getting more education. And he just made me think for a minute. He was like, teachers, teachers are always learning. That might be your purpose, that might be your path. And I thought about that and I said, I always said I would never teach. And they always say never say never.
Right?
Um, But after that, I soon got into adjunct teaching, which opened the door for a full-time assistant professor position, which led to a PhD that led to me being a program director now. So just like I said, that was my moment at that point in time where I used my God-given ability to learn and just that love, that passion for learning. And I was able to use that to get into education and to, like I said, teach the next generation of health informatics professionals and just help them to just find their path. And that being in education, I feel like that is it's such a rewarding feeling like no other because what I'm doing is setting them up for their future. We have students who come from McDonald's or wherever and they're ready for a change and they come to our program, they finish it, they get their certifications, and now they're a manager of a health information management department or they're a health informatics specialist and like it's you're changing lives. So I feel like my path led me into health information and into informatics and into education so I can make a difference in other people's lives. Still behind the scenes, but I get to, I get to show my face a little bit more in in the educator position. So I think that was my moment, just having that conversation with a colleague years ago.
Thank you for sharing that. Now let's explore equity and the future. How can informatics and data analytics be leveraged to address health disparities and improve access to quality care?
Yes, and I think that pulls back to a little bit earlier when I was talking about remote patient monitoring. So things of that nature in telehealth. My dissertation was actually on patient satisfaction with telehealth, and telehealth is it's a major it's a very it improves access to care, especially in rural places like where I'm from in Mississippi. There might not be a hospital within 45 minutes of you, but or a healthcare clinic within 30 minutes of you. But if you can connect with your doctor via on your cell phone, most of us have cell phones or on a tablet, that's a game changer for elderly populations. If they have a grandchild that can help them learn how to use that cell phone and use that computer to do a doctor's appointment, that's major, especially when you, like I said, when you pull in remote patient monitoring and you pull in those devices now where you can check your blood pressure at home and they can be pulled directly into your electronic health record while you're doing a visit from home, or when your doctor can monitor your glucose readings and they don't have to worry about the patient remembering to write down what their uh
The recorded
reading
report.
was
Yeah.
today. Just being able to automatically pull that into the system and doctors can trend that data for these patients without them even needing to leave their home, especially if they don't have access to transportation. If they don't have transportation is a major one. But if they're having some health concerns that day and they just don't feel like getting out, that keeps them from missing a doctor's appointment. And it makes sure that they're getting that access to care that they need. And you can pick up on things a lot sooner than when it's too late and you have someone in the emergency room or you have someone, like I said, in the ICU. That makes a huge difference in patient outcomes.
And just to expand a little bit on that, you mentioned fire earlier, and this is where fire, in terms of if FHIR comes in because HL7 brings about the FHIR, and it's to connect that type of data coming from gadgets such as cell phones and other types of digital tools that would allow elderly or other people who are not able to make it directly or instantly out of hospital or something like that, or communicate their information, their data to a doctor or their primary doctors. They are able to do these things, and the platform allows for that information to be communicated directly, instantly to your health records, to electronic health records, whoever is holding it for you. So that's an interesting aspect of that. We are getting into the last question. Looking ahead, what trends or technologies do you think will most significantly redefine health information management in the next 5 years?
What do I think will most redefine? Like I said, we talked about so many. Um, One thing in general that I think is gonna be is gonna take the world by storm, and which I'm excited to see, is probably precision medicine. Just being able to um, make healthcare specifically for this person, not a one size fits all, but making a health plan specifically for me, medications specifically for me that works with my body. I'm excited to see how that's gonna transform healthcare. But it all starts again with the quality data. You can't have all of these innovations without the quality of the data being there. This you have to have accurate data. You have to have um, reliable data, because if you don't, nothing is going to work as it should. So for me, I definitely believe precision medicine and all of that tied in with AI and predictive analytics, it's gonna be very futuristic here soon. I know. I remember what I wanted to talk about earlier with electronic health records. I know one in particular. They're pulling in their predictive analytics and their AI, and they're going to be able to start predicting outcomes for patients, predicting readmissions, predicting, um, okay, if this patient stays on this path here, they could potentially have diabetes in the next 5 to 10 years. However, if they make this change, um, they might not have this health issue. So I think that's going to be very interesting to see all of these innovative tools just kind of tie together to just create this new healthcare system. I know there's going to be issues and hiccups, of course, but it'll be interesting. It'll be interesting to see the changes.
Yeah. That's for sure. And as more data are being collected from different hospitals every day, I think the data analytics will be able to the prediction of those data gathering and saying, okay, so and so might be more likely to be driven back to the ER or emergency room or any of these things. You can AI will be easily be able to predict these things, and a lot of them are already in action anyway. But incredible outlook, and thank you for sharing your expertise. Um,
Before we go, can I ask you yours? What do you think?
Yeah, that's a good question too. I as far as the question itself and my expectations of what it would be in the next 5 years in the medical field, so much already ongoing. My anticipation is how super intelligent AI is going to be an issue in the medical field.
Mm.
And as a lot of companies are already working on um, 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 uh, quantum theories, imagine if a quantum computer comes about, there will not be a limit as far as um, keeping information away from anybody. So this is why it's a big race right now ongoing. And especially with AI expected to accumulate about $15.7 trillion in the next within by 2030. So that much is mostly for the United States and China. So if those two are competing so heavily, imagine what's likely to happen if any one of them finds out this is what I can do. So in the next few years, starting now and before, it's a very intense field it's going to be, and it's going to be in mostly in all different areas. So looking forward to the next 5 years. And ChatGPT just announced, well, I don't want to say ChatGPT, it's OpenAI, just announced they're working on super AI, which most likely might come by 2026, 2027. So a lot will be coming along the way. So we had not seen even ChatGPT that started March 2022, and then look where we are now. So it's a lot that being done in fast, and a lot of financing are a lot of fundings are being driven and thrown their way from Amazon, from um, Microsoft especially. So it's a lot being invested in there. So we have a lot to see coming up, and it's a daily activity. And it's hard to project what it's going to be in 5 years. It's not going that slowly. So we'll see.
Right. Thank you for your insight. That was very interesting.
Thank you. Thank you. I'll open the floor, the virtual floor for questions. By all means, if you do have questions, Dr. Watts would be more than happy to address them and answer them for you. Please ask a few questions if you do have.
Hello, Dr. Watts. I would like to ask you if you could clarify what you mean by quality data. I am not in the field, so I'm not sure what that entails exactly.
Yes. So when I say quality data, the one of the main aspects when you are thinking about data, there's certain things that data has to have for it to be quality. One of those characteristics is accuracy. So say like right now it's November the 1st, 2025, and someone is talking about when our podcast is, and they accidentally transpose the 5 with the 6. So if they say November the 1st, 2026, that wouldn't be accurate data because that number is transposed, it's not correct. So think about that happening on a larger scale in healthcare. So you have a patient coming in and they have um, type 2 diabetes, and a physician, they're typing fast and they accidentally put type 1 diabetes. Well, when that data is going in and we're analyzing that data, that for that particular patient, it's not going to be accurate data. So when we're looking at, we're doing predictions for this patient, or we're doing all these predictions, and we have all of these people who might accidentally have type 1 diabetes when they really have type 2 diabetes. All this data that we have is not going to be accurate data, which can cause problems in the long run, especially when we're trying to improve patient care. Just something as that might seem small like that will affect patient outcomes in the long run. Even especially in health information management, one of the main things is um, incorrect names when you go to the doctor. Someone, if say I with me, Alicia Harris, if I go to a physician's office and I've been there before under Alicia Harris, and I go in a month later and I say Alicia Watts, if they don't ask me my date of birth, if they don't ask me my social security number, they might make two records for me in the system. So that's going to cause data quality issues because, okay, now Alicia Harris has a record. Now Alicia Watts has a record. Alicia Watts' health record doesn't have the same things in it that Alicia Harris's record has in it. Alicia Watts' record doesn't have my allergies in it, but Alicia Harris's record does. So when you think about that, you can think about all of the potential problems that could cause. So this when I say data quality issues, that the data has to be accurate, it has to be precise, it has to be reliable, because if it's not, when we're running these reports, our reports aren't going to be right. So I hope that answered your question.
Yes, definitely. Thank you.
So, Dr. Watts, this is pulling Dr. Lloyd. And I have a statement and then I have a question. And so as I come to the end of my working career and I'm starting my business and I'm already looking at my exit plan and my succession plan for my business, I have a 7-year plan. I am so inspired by young professionals like you. I get goosebumps when I hear how brilliant and how compassionate and how passionate you are about the work that you do. So I just wanted to say that first. And I said that and I forgot. I'm having one of those brain farts. I forgot my question. And so I'll think about it later. But my question I'm going to pose to future Dr. Claude. I know he told me not to call him Dr. Claude until he finishes, but it's coming. So Dr. Claude,
Next year.
okay, but you have brought together some phenomenal scholars and some phenomenal people in their field in their fields. And so, is there a way that you can connect us, right? To keep us connected? Because the information that you are giving here really needs to be on at least a state form to begin, if not a national form. This is world class information. And so, in what ways are you going to take the Dr. Watts, the Dr. Lloyds, I can't remember the other doctor. In what way are you going
Yeah,
to,
Dr. Joy
Dr. Joy?
Allen.
Yep. In what way are you going to bring us together on a united forum so that we can share our insight and our information?
Well, thanks, Dr. Lloyd, for such a good question. And it's a good thing to think about right now. I guess I'm gonna think about a platform where this can be done. And one of the ways that I think it can be done is by inviting some of the previous guest speakers who were there before. And during this presentation, then we can share our contacts or bring about some ways to communicate. Or what I also can do is to add a space on my website where these things can take place in terms of connecting all the different guest speakers who were there before, and this way then communication can take place. But a little bit more into that, it's something for me to delve into and look in what way that can be done. And that's a very beautiful thing that you
Yeah.
brought about. So I'll definitely look into that to make it happen.
So,
Uh,
so, so I'm going to offer a collaboration. Earlier this year, I keep saying last year, but it was just in
they go
January.
so fast. They go by so fast. So that's
Yeah,
understandable.
in January, I did an ethics conference. And so as I'm planning for 2026, I wouldn't mind doing an ethics conference and have it focused on cybersecurity and healthcare, and we can figure out how we're going to get everybody in one place in person and have it podcast like here in New Jersey. But we'll talk about that offline. Yeah.
Yes. And Dr. Watts, Dr. Lloyd is a previous speaker. She was here just like you, sitting there answering our questions and addressing some of those questions that she also had from the audience. So yes, that's why, and she's been very supportive of this podcast, and I'm very thankful for that too.
You know, actually, I was thinking that this along the same line, because I feel that this type of endeavor, this type of uh, tool, I feel that this is a tool. It's a learning tool that people can access at any point on the internet. I feel that it should have had a lot more impact, a lot more audience than what it is getting right now. But at the same time, I know that this is the beginning of the podcast, but I feel that this is something that people should encourage more, and I actually commend you, Dr. Lloyd, for suggesting that.
And one other thing is that I would highly encourage those meetings or anyone intending to attend if they could also share to anyone whom they think might be of interest to them. They can encourage them to do that. And Dr. Watts, it's not done yet in terms of not making sure everybody has a questions, but I perhaps would like to ask you maybe next time if you would be able to be in the audience, just like Dr. Lloyd is, if that's okay, or if you're able to, whenever you are able to. So, but for the next Saturdays coming up, we'll be having all the way down to December meetings. So Saturday, we're gonna have Miss Andrea Finlay. It's gonna be more so on AI. So she's gonna be here. It's gonna be at 7 o'clock, just to let everybody know ahead of time. I'll put the links on LinkedIn. My website is it's a cyber clinic podcast. I don't know if everybody has that yet. Cyberclinicpodcast.com. That's just the website. It's Dr. Watts, you're gonna see your name there. You're gonna see the post, the cover that we had announcing you coming in today. So that's gonna be there as a past speaker. So yeah. Any other questions?
Yes, actually, I'm Dr. Watts. If you could give advice to young children, to young girls coming up and who are actually in school, maybe middle school. And I'm specifically speaking of my girls because they're in the audience and they're listening. What advice could you give to them in terms of some tips on how to orient themselves toward um, exercises of excuse me, academia? How do they get some advice on how they get themselves versed into that?
Yes. I would say, first of all, keep your grades up. That's very important. Start now, start getting into the habit of, studying and just learning all you can early. And then when you start getting in high school, that's when you start thinking about, okay, so what do I want to be when I grow up? Where do I want to go to school? And which it might change because from what I wanted to be as a senior in high school, that's not what I am today. It can definitely change, but if you kind of know the path you want to take. So I always knew I wanted to be in healthcare, and I always knew I wanted to help people, and I always knew that I didn't want to deal with blood. So I knew that being a doctor or being a nurse wouldn't be my path. But think about what interests you now, and when you go to school, start gearing yourself towards what interests you. Another good advice that I would give anyone, especially leaving high school, go where your scholarships are. I know a lot of times when you're leaving high school, you just want to get away from your family and you just want to go to the furthest state away. But if you don't have a scholarship over there, whatever state there may be, don't go. Go where you have some funding, because that will make a difference in your long-term financial growth. Just if you can get most of your college paid for with scholarships or other types of funding, that sets you up for after you graduate, you don't have to worry about being in debt. So definitely follow the money. That's what I always say. Follow the scholarship money. But like I said, just finding what interests you is the main thing right now. Just thinking about, oh, well, I like helping people. How could I help people in my future role? So that's the advice that I have, especially with middle school right now, keeping grades up and thinking about what interests you. When you get to high school, follow the money.
Thank you.
You're welcome. Oh, and get a mentor. That's a great one that I just thought about. Find a really good mentor. When you find out what interests you, find a mentor in that field and just learn all you can about it, because that might change you. Like I said, you might change what you want to be when you grow up, but that mentor will always be there to kind of help, kind of keep you grounded and kind of keep you on the right path.
Yeah,
So
excellent.
Dr. Watts, I'm telling you, I have to have you at a conference. And so here's my last question, and then I'm going to jump off. And it has nothing to do with anything that we've talked about today. It has to do with your hair, right? Because one of the things that can become, I think, a distraction in the conversation of following the money and keeping your grades up and all of that kind of thing is the Crown Act and how Black women are going to wear their hair and all of the money. So I'm natural. Are you natural or relaxed, or how is your hair?
Yes, I am natural.
Okay.
I have been natural for almost 6 years now. And I do wear my natural. I do twist styles, some red curly sometimes. But just recently, just with my new job and not having as much time to just take care of my natural hair, I'm more of a straight natural now. So it's a natural. It's just a straight natural. And like I said, it's just because I don't have the time to care for my hair in its natural state. So it's easy for
Right.
me to manage and for me to handle when it's like straight, because I can just kind of grab it and take it down
Yeah.
and
Yeah.
make sure my moisture levels are there. It's hard to
Yeah.
keep my moisture levels right when I'm wearing it in its natural and its curly
Yeah.
state.
And the reason that I ask that is just because of the difficulty and the time that it takes to do natural hair. I was like, I've been natural probably for about at least 25 years. And I was like, I think I'm going to relax my hair again, but I'm not. I just need to get
Don't do the
it.
chemicals.
Don't do the
Don't put
I got
those extra chemicals.
I got you.
Think about the health outcomes, long-term outcomes.
So that was my last question. I have to leave you to grab my grandson. So thank you.
Thank you so much,
Thank you.
Dr. Lloyd.
Hey Lucy, you've been absent, you've been quiet. How are you
just listening and absorbing all the great information, you know. And I like what the doctor said about, you know, when Dominique asked the question about how do you guide young children in middle school and stuff. And you know, with me, I have Dylan that's, you know, graduating out of high school soon. And
Right.
you know, it's so inspiring to hear from all of these people that you have on the panel, educated, you know, women, you know, and that are giving back to us their time, their treasure, their talent. I so appreciate these podcasts because if you didn't connect us with these people, how would we know certain things? How could we
Yeah.
continue being inspired with the gift that they have of knowledge and their time that they're giving to educate us? This is such a wonderful platform. And I really thank you, Claude, for putting this together. And I really thank the speakers because I know they're on for your time and your treasure. You don't know the impact that you're having on us here. I really appreciate it, and I'm grateful.
Thank
Thank
you.
you.
Thank you. Thank you so much.
I wonder who
Yes.
the
Thank you. Any more questions? Anyone? No? Well, if there are no more questions, Dr. Watts, allow me to read my little conclusion for you. Thank you, Dr. Watts, for such an enlightening and inspiring discussion. Your leadership and commitment to advancing health informatics, empowering future professionals, and driving innovation at the intersection of technology and patient care are truly remarkable. Your insights today have provided us with a deeper understanding of the skills, systems, and mindset required to build a data-driven healthcare future, one grounded in quality, equity, and continuous learning. We appreciate your dedication to education, clinical excellence, and the advancements of the next generation of health informatics, of health information leaders. On behalf of all of us, thank you again for sharing your time, your expertise, and your passion for transforming healthcare through informatics and education. I mentioned earlier we meet virtually every Saturday. I truly look forward to having you with us next Saturday, and that's going to be also an exciting meeting that's going to be focused on AI and everything. Dr. Watts, thank you so much for your time. Again, that was very kind of you.
I'm sorry, but Lucy, maybe next time if you can invite Dylan to join.
Yes, he was in the background briefly. He was putting he today is the last day for him to file for some of these colleges, so he was like under
Oh,
intense pressure.
yes, yes.
Yes. So there's a lot going on.
Awesome. Yeah,
Yes. Yeah, but next time for sure, if he has the time, I want him to
yes, of
listen because
course.
you listening and you learning. This is impactful
That's
stuff.
it.
Yes. Thank you for that.
Thank you so much. Soon to be Dr. Claude. If you don't mind sending me the link for next week, I would love to join.
Oh, great, wonderful. I'll make sure to do that. That's gonna be on the that's gonna be on the at 7 on Saturday. Yeah, on Saturday. Someone just came in actually. Just come on. We were just wrapping up because we weren't able to stay beyond that, I guess. But whoever that is, thank you for coming in. Welcome. And this was Dr. Watts. We elaborated on a whole lot today, and she interacted with the audience on so many fronts. And this is Marlon. And thank you so much, Marlon. And maybe next Saturday, you might be able to make it on time with us. I know you're in a different time zone, but it's going to be at 7 o'clock here. So most likely it's going to be 3 o'clock for you. Yeah, that's understandable. Yeah. Marlene is an educator as well. So she was involved in a lot of grading at this time. So it's going to be at 7 p.m. on Saturday. I'll send everybody the link and we shall see you guys again next Saturday. And I thank you again, Dr. Watts, for having been here and the audience as well. for having been here. Yes, next week, November 8th, next Saturday. But I will also have somebody else on the 11th. She's the dean at the university, at Rutgers University. Unfortunately, it's not going to be on a weekend. It's going to be on the 11th at 3:30 p.m. Eastern time. So it might be a holiday. I think it's a holiday, the 11th. So if any one of
Yes,
you might be able to, okay. So if any one of you would be able to make it, by all means, I'll do that, and I'll put it on my website as well, just in case you would want to visit and see. So that would be wonderful. On the 11th, that's gonna be when it's gonna take place. Yes. Right, November 11th at 7:30 at 7 p.m.
Tuesday.
It's gonna be Andrea Finlay. Yeah. Yes, it's on Tuesday, correct. Yes, again, thank you kindly, everyone, and I shall then see you again next week. In the meantime, if I have anything that I'll put together for uh, the usual podcast that I usually do, I have a lot of recordings. I've got more than 20 podcasts that I have done individually without having an audience. So you are welcome to listen to a lot of them. They're very educational and informative. So if you have a chance, please, by all means, check them out. Yes. Thank you, everyone, and
Can you
have a great.
post that? Can you post the link to your website? Was it in the text message? Sorry, Claude.
Yes, I can either send it to the text message, but all of them
Okay.
are also posted on my website.
Right, it's the website I don't think I have.
Oh yes, it's Cyber Clinic Podcast. Let me put it in the.
Oh, okay. No,
Yeah,
I got it. Sorry.
yeah, I have
Thank
it
you.
here. Yeah, cyberclinicpodcast.com.
Yes, thank you.
Yes, thank
Bye-bye.
you so much, Molly, for being